So we're at the Strengthening Disability Advocacy Conference, and I'm talking to Marie Mallett, and you are the CEO, and I've clicked my wrong page,
of Dana.
The Disability Advocacy Network Australia, which is a peak body for disability advocacy at a time of dramatic change, as we've just heard, that you were part of the session on Rights Camera Action. How do we get, as advocates, get issues on the public agenda? And you talked about a range of issues, not least that the disability sector is still regarded as other. Can you expand on that for me?
So I think the longer somebody works or lives or works in the disability sector, sometimes they inhabit that space. So the disability sector is where all their time is spent. And if a person who has a disability themselves is also working in the disability sector, then that is their whole life. And sometimes it's not as clear that for other people in the community who have no contact with the disability sector, who don't have a family member with a disability, for them, people with disability are just about invisible, unless they see a little story on Facebook asking for, a crowdfunding thing to buy somebody a wheelchair or something. And because people with disability are often really invisible in the community. They're still often quite segregated into. They're working in what are now called Australian Disability Enterprises. It used to be called sheltered workshops. So that's where a lot of people spend their days. They're doing group or daytime activities. They're kept, not consciously, but it works out like this, that they're not able to do things the way the rest of the community does, and sometimes it's actual barriers like transport, that the railway station near them doesn't have a lift. They can't get to they can't get into the station. There are other reasons though, because a lot of it's to do with poverty. So people with disability tend to not be employed. Australia is 26 out of 29 OECD countries, and not in a good way, in a bad way, for employment of people with disabilities. So generally speaking, people with disabilities in Australia don't have a job. You could, if you generalise, often they're not employed, so they don't have money. They are just entirely dependent on social welfare. They tend to not have savings. They tend to not, so they haven't got money to spend. They're not. This is for people who've had a disability their whole lives. There's a slight difference between people who acquire disability in older age, who may have worked their whole life, have some savings, and have some money to spend. But anyway, there is a big issue in Australia about people with disability being invisible and not being a full part of society, and therefore it encourages perhaps this thing about them being regarded as other by the rest of the community.
Which then, of course, allows governments to fund on or to speak about the issue as an individual thing rather than a systemic one. And you were talking that that's the big issue, is to get on the agenda in the bigger picture, but also for it to actually be able to do that systemic advocacy.
Yes, so and a few people today have talked about the fact that for people who've been involved in disability advocacy for a long time. Frank Hall-Bentic was an example today who talked about this. They see that there is now, they feel like there's less systemic advocacy being done, and I think most people probably agree with that. When the disability rights movement was at its height, which is far from it now, but when it was, and that's at the same time as a lot of the other civil rights movements were, there was a force happening, but that's 30 years ago, that there was a lot of activism happening, and things have changed. Either society has changed, the way people think about things have changed. I don't know exactly, but it's changed in other movements as well. It's not just in disability rights. In the Greens movement, there's less people chaining themselves to bulldozers and trees, and there is more political, systemic work. But in the disability there was stuff achieved at the time when the disability rights movement was very strong and active, and some of the stuff that was achieved was funding, which included funding for advocacy, and a lot of that was systemic advocacy at the time. Over time, what governments do when they're funding something, they tighten the rules. Bit by bit by bit. They bring in more compliance, they bring in quality assurance processes, they have to do something with these funded programs, so they just keep tightening them up. And it means that the people who work for the funded advocacy organisations have less ability to be creative in the work they do. They are more restricted in the way it's worked now. Mostly they do individual advocacy, one-on-one, with a person who has a significant issue that they need help with to navigate a system or resolve a problem. And that's unending. There are more and more and more people who need that help. And so that's where they spend their time and energy and effort. But probably at the expense of some of the work that should be being done in systemic advocacy. And governments, of course, are less keen on funding systemic advocacy because, of course, who are you arguing to? You're arguing to a government about something that they provide. They don't necessarily want to hear that message, and they don't want to pay for it to be done.
You're not going to lessen their demand upon them by doing that.
So, but people who, when systemic advocacy works, of course, it can make big changes in people's lives. But it takes time. It takes years and years and years of lobbying to get a piece of legislation changed or to get something to happen that will have an impact on many lives. And in the meantime, the individual advocates just keep plugging away at working with each individual one at a time. So we need both, and unfortunately we haven't got enough of either.
You also talked about there being a lack of leadership at the moment in the disability sector overall, and you talked about the competition that there is out there, but I think it goes beyond that too. But it's at a particularly auspicious time with the rollout of the NDIS. What are your concerns there?
Yeah, the leadership thing is difficult. So I did get beaten around the head by some of the people who are the leaders in their area. I think feeling that I was being a bit dismissive of their work and efforts. So I suppose what I was clumsily trying to say about the leadership was, so there are people who have been working in one state, for instance, in the disability sector in one state for 20 or 30 years, and they are indeed well known to all the other people and players, and they have influence and they have a voice, and they've helped to get systems changed. But they may not be visible or connected with people in other states or at the national level. Some of them may be, but maybe on one issue, which is to do with housing for people with disability. So they are invisible, effectively, to all the people who work on all the other issues. And one of the reasons for that is because there is very little... there's only little pockets of good collaboration and networking, and it's because it's expensive. It's hard to get people together. A lot of the people who do this stuff, the systemic advocacy, they do it off the side of their desk, or they're in a completely unfunded capacity at all, and they don't have the time. They haven't got the money to get to events. Today's event, this Disability Advocacy Conference, is a rarity. So Dana, my organisation, the National Peak, has only been around for about 8 years anyway, and we used to run national conferences, and they were the Dana ones and the Daru ones were the only place that people got together to discuss these issues. We currently don't have the funding to run a conference. They are expensive to do, and actually the people who do disability advocacy mostly can't afford to get to the other disability conferences. There are plenty of conferences, but they run usually for service providers, and so the voice of people with disability themselves or the advocates are not heard in those places.
So given that the NDIS is going to produce some amazing changes, and we're already seeing great gaps, great glitches, great goodwill as well, what's needed? What could you, if you had an audience with the Prime Minister, what would you tell him you need?
We need, so the immediate focus I would have is that we need more money spent on providing disability advocacy at different levels. We need more individual advocacy available to people who need it. We need more advocacy support for families who need strengthening and support in their advocacy. We need much more funding and resourcing for self-advocacy training for people with disability themselves, and particularly people with intellectual disability, to be supported to become good self-advocates. But they still need to be able to contact and get ongoing mentoring and support from professional, paid, independent advocates when they can. We need training for support workers about what advocacy is, and for all of the service providers to make sure that they know when they should be linking one of their residents or clients or people they're providing services to into an independent advocate. When it is that an issue needs somebody who can focus just with that person on that issue and get the outcome that they need. And we need the state governments, that there's a huge risk now with the NDIS, which is that some of the state governments are perfectly happy to hand over everything to do with disability to the Commonwealth Government. So the funding of it now goes over to the Commonwealth Government, but the concern is that as the state governments wind down their disability departments, maybe don't have a disability minister anymore, who will pay attention to all of their state systems? So a lot of the advocacy that happens, that advocates are working with people to help them on the issues, they're state systems. They're health, justice, education, child protection, housing. None of those are Commonwealth issues, they're state issues. So state governments have to maintain a focus on disability issues and on providing the right services for people. So that's a big risk in the next couple of years that we all have to pay attention to.
I think we have to stay watch this space because we're about to resume after lunch, but thank you so much, Mary.
Yep.